Thank you. Good afternoon. Thank you for the invitation. Okay, I will talk about the pharmacological treatment for presbyopia, the Benozzi method, created by my father, Giovanna Benozzi. It was a long time ago, in 2002, that we started to treat our presbyopic patients with our pharmacological treatment. But it was after 2009 that we started to promote the treatment and to train ophthalmologists in Argentina, about 80 of them. That was once we had the first patent in Europe. In 2009, the Benozzi method received the award given by the Argentine Ministry of Science and Technology. Then we gave some presentations, including my father's presentation in Presbymania 2011 in Geneva. Once we got the different patents all over the world, we started to publish our findings. We are currently preparing some series of studies for publication about our treatment. We also published our experimental research. I'm very proud to be part of a group of investigators with whom we developed an experimental model in pigs to study cholinergic stimulation in ciliary muscle and iris muscle, and to better understand accommodation. We are currently conducting our research in similar models in human eyes. These models allows us to gain a better understanding of the intracellular signaling pathways of the different subtypes of muscarinic receptors. Accommodation is basically the shift of the power of the refractive power of the eye that allows us to focus on objects located at different distances. It depends mainly on the parasympathetic nervous system. As you all know, the accommodation triad involves the ciliary muscle contraction that changes the shape and the position of the lens, the iris contraction that changes the pupil size, and the convergence of both eyes. In all these years, a number of scientists conduct a research to find a pharmacological treatment for presbyopia, and to better understand the predominant role of the parasympathetic system nerves in accommodation. Reports show that the ciliary muscle is always in contraction, and this contraction will change depending on the focus distance. The ciliary muscle only relaxes completely in total darkness or under a very high sympathetic discharge, like a stroke or like a pharmacological induced condition. Based on all the above, my father developed the pharmacological treatment for presbyopia, Benozzi's method, that permits to rehabilitate accommodation by physiologically stimulating the ciliary muscle, using different combinations of cholinergic agents and NSAID, adjusted according to the specific needs and characteristics for each patient. The presbyopic patients are able to focus naturally at all distances, as long as they use the treatment or until the lens loses its properties. Our ideal patient is the metropic presbyopic patient with a refraction between plus 0.75 diopters and minus 0.50 diopters, and with no pathologies associated. First of all, we perform an ophthalmological exam where we evaluate refraction, visual acuity, near vision, fovea, slit lamp examination, intraocular pressure, fundoscopy, peripheral retinal examination, and cycloplasia. After the ophthalmological evaluation, we stimulate accommodation using a combination of cholinergic agent and non-steroidal anti-inflammatory drug adjusted for this patient, and depending on the evaluation and the result, we can determine whether the treatment will be successful and whether the patient is a good candidate for this treatment in particular. As occurs with all treatments, the selection of the patient is essential, and the examination of the patient thoroughly. It is through experience in prescribing the proper treatment that we can achieve a good, successful treatment. This treatment is a chronic treatment, so a long-term follow-up is mandatory. I will show you now a statistical study to illustrate our experience with the pharmacological treatment. We performed a study in 3,219 consecutive patients treated at our clinic between 2002 and 2013, where efficacy was considered a 40% improvement in performance compared to baseline or reaching 20/20 visual acuity and Tiger 1. The total population was 3,219 patients, but we will focus on the 1,526 emetropic patients. As you can see, about 50% of our patients were women and 50% of the patients were men. Our mean age was 52.64 years. The efficacy of the treatment for far vision in emetrops was 97.4% of the right eyes treated and 97.9% of left eyes treated. The efficacy for near vision in emetrops patients was 96.7% of the right eyes and 97.3% of the left eyes. The main side effects were headache, decreasing luminosity, and burning. 7.6% of our patients reported having a headache. This headache can last about 20 minutes and it was during the first days of treatment. After that, the symptom disappears. 34.7% of the patients perceived that the light was dimmer in mesopic environments. This symptom disappeared too after weeks due to neuroadaptation. 21% of the patients felt burning at the moment of the installation of the drug. It is important to emphasize that this is a chronic treatment, so monitoring of patients is essential. In this Kaplan-Meier curve, we can see that the performance achieved at the beginning of the treatment can be maintained, and it's maintained during time. So we can conclude that this treatment has a high rate of response, that the results are stable through time, and the low incidence of the side effects. So to conclude, we have 15 years of experience. Our work group comprises around 80 ophthalmologists who successfully applied the treatment in Argentina. To date, we have approximately 25,000 treated patients on our files. And 10 years ago, we started conducting scientific research studies using animal models and human cells with the aim to improve the pharmacological treatment. This treatment, the Benozzi method, has proven to be successful when used in the right patient. And this is a good treatment choice among the currently available treatment options for presbyopia. To finish, I want to remember and bring us to mind that we are in this exciting and very promising road thanks to the inspiration and the tremendous vision of my father, Giovanna Benozzi.